Here are a few things to watch out for that could indicate your shoulder pain is caused by a serious injury. My name's Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Shoulder pain can be caused by a variety of different injuries and conditions, and it's important to know what the cause is for that pain so you actually get the treatment that will get rid of it. Now, some causes of shoulder pain are easily treated. Others require a more extensive treatment plan. If your shoulder pain persists or gets worse over time without improvement, obviously it's worth seeking medical attention. So pain's the most common symptom of shoulder injuries, and it can come in many forms. The pain can be sharp, pain can be dull, could be a burning sensation, could be tingling, may be present at rest, it may be present when you move your arm in certain ways, may be felt in the shoulder itself or somewhere maybe down in your elbow or down in your wrist or even your hand. The severity of pain varies widely depending on what has happened to cause it. Minor sprain might produce only mild discomfort with really no impairment of what you're able to do functionally. A torn ligament could make lifting anything heavier than maybe a glass really painful and really difficult. Obviously, some sort of fracture might require extensive rehab, if not surgery, before you can get back to normal activity. Weakness is another important symptom to help differentiate what's going on. If you have weakness in the shoulder, weakness in the arm, weakness in certain positions, maybe overhead, out away from your body or behind your back, weakness with those positions could indicate a rotator cuff tear. Just as an example, if you're having trouble raising your arm up overhead and keeping it there without pain or discomfort for more than a few seconds, it could be, you don't know for sure, but could be an indication of weakness or an injury to one of the rotator cuff muscles or tendons. Decreased range of shoulder motion, decreased range of motion of your shoulder, another common symptom, can be caused by a number of different things. Could be injury, obviously, but it happens sometimes as you get older as well, something like a frozen shoulder. But if you have decreased range of motion, it's important to see a doctor or physical therapist as soon as you can. Shoulder pain is one of the most common reasons for people to see their primary care physician. A physical therapist can help you regain some of that lost shoulder strength, increase the flexibility, things like exercise treatments, manual techniques, massage therapy, things like that. Another symptom, feeling like the shoulder's loose or going to pop out of the socket. If you feel like that, it could be a sign of what's called instability. The rotator cuff muscles, the labrum, the ligaments around your shoulder are responsible for keeping the ball in the socket. When one of those or multiple of those are injured, it's harder for them to keep that ball in the socket. If you notice that feeling like it's going to slide out of place, especially if you feel it on a regular basis, or it just happens once, but it seems significantly severe, it's probably worth seeing an orthopedic surgeon who specializes in shoulders, because a lot of times that needs surgery. If you have pain, you have weakness reaching overhead or out away from your body, if you have decreased shoulder range of motion, if you feel like your shoulder's loose or that it might spontaneously dislocate, it's important to see a shoulder specialist, especially if these are new symptoms or really only been going on for a few weeks, or if they're severe enough to interfere with your daily activities. I'd love to hear about your experience with your shoulder injury. Leave those in the comments below. Just understand I can't offer you medical advice there, but I can try to answer your question in a future video. Make sure to subscribe to my video channel. Click the bell to be notified when I release a new video, and I guess I should say when I start a live stream like my Ask Dr. Geier live shows. Thank you so much for watching. Look forward to helping you feel, look, and perform better than ever.